Good afternoon. I'd like to call the Health and Human Services and Aging Committee to order for Wednesday, December 1st. My, has the time flown. Can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county YouTube page. Carding the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Turner.
Present.
Mr. Miller.
Here.
Ms. Stevens. Ms. Stevens is absent at the moment. We have a quorum.
All right, thank you, Madam Clerk. I would like to do the approval of the minutes before public comment. Can I have a motion to approve the minutes from the November 17th meeting?
I so move.
Moved by Miller, seconded by Sweeney. All in favor, please say aye.
Aye.
Now let's return back to public comment. Madam Clerk, is there anyone signed in?
Yes, we have one person signed in, and that is Lou.
All right, Ms. Lou. Welcome and happy December 1st.
Good afternoon, everybody. Before we get into the two important topics which will help our people in the community very well, I have to, unfortunately, to bring some bad news, which was the continuation of the November 8th event, which occurred to me unexpectedly or expectedly. Our under-budgeting affecting the community for a long time, and this really has to stop. Right now, this morning I resent the photos to all of you. Ms. Turner, that will be your first time seeing them. This actually, originally I took the photo for a different reason, but coincidentally, a few hours later, my physical assault happened. So you can see in this room, you have 6 bunk beds which are not installed properly, not properly positioned. It may look like it utilizes space, but it actually is very inhumane, which actually agitate people because people cannot move around with a social distancing. And this is the reason why my attacker, even she's not a drunk, not a drug addict, not having any violence traits in the past, not have a severe mental health issue, this kind of setting still finally make her lose it. When she attacked me, I was already out and she still didn't stop. Then, after our Thanksgiving Day, the so-called Black Friday, it was black enough. The same person had to attack another person in the room. Again, same room. Yes, the cost may be trivial to the people who don't live in that kind of environment. But under budgeting is the main reason why we have a horrible living situations inside of shelter, temporary or not. Actually, it's a very trauma-enforced environment. And you can see for somebody who used to be a loving, caring person to turn into losing control, being violent. And the result, after yesterday, the so-called mediation, this person can still stay in the same room because we do not have enough space to accommodate people. But that means this type of situation will repeatedly happening. This is a public health and public safety issue as well. Is that really proper to put people already traumatized with their struggles to put into more suffering? Thank you for listening, and we need your help. Thank you.
That's all for public comment. Your microphone.
There are 2 items that are referred to the committee today. We're going to go out of order. So, Madam Clerk, if you could read the item B into the record, please.
Resolution 2021-0280, making an award on requisition number 5806 to Oriana House Incorporated in the amount not to exceed $2,100,000 for administration and operation of the Neighborhood Reentry Resource Center and the Adult Transition Model for the period July 1st, 2021 to December 31st, 2024, authorizing the county executive to execute contract number 1983 and all other documents consistent with said award and the resolution.
Good afternoon, David Merriman, Director of Department of Health and Human Services. I'm here on behalf of the Office of Re-Entry, as well as for the next council item, the Cuyahoga Job and Family Services, to bring these matters before you. I'm going to ask my colleague Paul Porter to come forward and on behalf of the Division of Contract Administration and Performance. Paul will introduce the detail on each of these items. He's been joined today by Simeon Best, the Director of the Office of Re-Entry, and Kevin Gowan, the Director Administrator of Job and Family Services, for the next item. So I'll call Paul Porter up, and I understand we have members from the provider team for each of these contracts in attendance today as well, if there are detailed questions on the services. Paul, if you could carry forward the presentation.
Thank you, David. Afternoon, committee members. This is an item for the Hhs Office of Re-Entry for operation of the Re-Entry Resource Center, the Neighborhood Resource Center, and the Adult Transition Model. The vendor that we're recommending for award was the sole respondent to an RFP that closed in May. There were some delays with submitting this contract due in part to accounting issues in the Infor system. The Office of Re-Entry had to switch from one type of accounting unit to another when there was a technical glitch in the system, and that took a while to make sure the funds were properly routed to be able to get this contract through. Additionally, the Office of Re-Entry had some staff transitions that left them with a little bit of a knowledge gap in getting this item into the system. My team worked with them to get this and a couple of other items through, and it's anticipated that moving forward, my team will help them with submission of their contracts and with the issuance of their RFPs. This is one where they had issued the RFP on their own, and our involvement came kind of after the fact. Again, it's the same vendor that was delivering these services previously under a contract that expired June 30th of this year. So we do have it backdated to July 1 because services have not ceased for this. We're putting the contract through with a value of $2.1 million and a period of July 1st, 2021 to December 31st, 2024. So it will go through the end of that year. And then our goal is we would issue another RFP sometime during the first quarter of 2024 to be able to get a new contract in place. As Director Merriman mentioned, Simeon Best is here, the new director of the Office of Re-Entry. Additionally, we're joined by Marcus Bell, a representative for the vendor. I'm happy to answer any questions about the contract side of it. For programmatic questions, I would defer to Simeon and to Marcus.
Any questions? I saw Miller first and then Sweeney.
Madam Chair, I would like to direct a question to Director Best, if I may. I am pretty familiar with the Neighborhood Re-Entry Resource Center and have actually done a tour there at least once. But could you say a little bit more about the adult transition model?
Absolutely. So I'm going to allow Fred Bolton here.
Excuse me, is your microphone on?
Is it on? Yeah. Maybe I should take the mic. I'm going to try to speak louder. I have Fred Bolton here who will definitely be able to speak to the adult transition model and that part of the contract. Fred?
Excuse me, can you also state your name for the record?
This is a new contract.
State your name for the record.
State your name.
Oh, sorry, Fred Bolton with the Office of Re-Entry. This is a new contract which was competitively bid. for, actually, this is, it was competitively bid, and this was the only offer received. Oriana House has operated the North Star Neighborhood Reentry Resource Center since its inception in 2010 or 2011, and it has been bid out through an RFP basically every 3 years. They are the only ones who did submit a contract. However, this is also an amendment because we have a federal grant. And the federal grant was expired September 30th of this year, but we had requested and received after September 30th an extension of the grant. So what we have here is basically a competitively bid process, but it's tied to an amendment to the federal grant where Oriana House was running the adult transition model. So it's sort of a combination of the two. It's a continuation of the grant from with federal funds, and it's a new 3-year contract for Oriana House to operate the North Star Reentry Center and the adult transition model, which pre and hopefully soon post-COVID, they went and worked with prisoners in state prisons and would be in the county jail pre-release to help transition them out when they get released to continue services at North Star. So it's a way of building a rapport to get these people involved, find out what their needs are while still in the institutions, to be able to address them as soon as they get out and to continue that. The program since its inception has gotten about 10,000 members. Members are people who come there and there's no charge for membership, but by becoming a member, they get a sense of ownership and feel it's theirs and they have some place to go. It's a welcoming center. It's also a place where it's a one-stop shop for all things reentry, for referrals, for information, and for programming. They have programming on site from many different organizations. They have meeting rooms that they make available to county groups and to people in the public. So it's really a combination of a safe place for people to go when they leave incarceration and a source of information and services so that we will reduce recidivism and build stronger families and stronger communities.
So I know that we have about 3,500 prisoners that come from the state back from the prison system into Cuyahoga County every year, a number that's actually down a little bit, but still very substantial, and that doesn't include the people from our own county jail. So it's a very important program to getting people reintegrated back into the community and socially and economically successful. So I support the services and wish you well. Thank you.
I appreciate that.
Mr. Sweeney?
Thank you. I have questions for somebody else, but I appreciate your presentation. Marcus, you want to come up? If you don't mind, he's the gentleman from Oriana House.
So Marcus Bell from Oriana House, North Star.
I just want to thank you for coming up. One of the first things I did was take a tour like Dale said he just did, and I was just impressed. And I'm just wondering, how's it working? Is this 2.1 going to help you administratively? But when I was there, it was kind of tight, right? We were on a day that was, I think we were doing it.
It Yeah, we were doing produce, literature, and I think at that time it was during the census time. So I think the 2.1 definitely will help us. So to piggyback kind of off of Fred and to give more expansion on the CCATM program. So we currently go into the institutions, which is Ohio Department of Rehabilitation and Corrections. Pre-COVID, we did go into the county jail. Because of restrictions right now, we haven't re-entered into that facility. But right now, we're currently into Northeast, which is the women's prison down on 30th in our downtown Cleveland location. We're at both Grafton's, so it's the Grafton Correctional Facility and Grafton, the reintegration camp. We're at Lake Erie Correctional, and we're at Lorraine Correctional. So what we do is my staff go in 120 days prior to individuals being released from the institutions, and they begin to address those barriers. As you know, it's a lot of people that have a lot of barriers getting released from the institutions. So we learned that it's easier to build a rapport and build a relationship to continue that on-site and referring them to services. So that's why we go into the institutions. Outside of ODRC, we do assist the local halfway houses here in Cuyahoga County and throughout Cleveland. So we have Harbor Lights here in Cleveland, Oriana House, CATS, and other facilities like the local shelters, which is 2100, City Mission, and Norma Hurd, who can refer clients to us to receive services. Our main focus are individuals that have some type of criminal background, but we do help any individual in Cuyahoga County that needs some type of help. Some of that help can be anywhere from education, where we assist them with getting their GEDs and things like that, vouchers for state IDs and birth certificates. So with this 2.1 and to help us, during the pandemic, we already knew that housing was a big issue, but with the pandemic, it hurt a lot of our clients more with securing security deposits, rent assistance, utility costs, and during that time, we've been assisting in the best way we can. So with this money, we had already spoke with the Office of Re-Entry and Director Best, and we had to give him draw up a plan of what we would do with monies far as assisting clients, continue to be able to assist them with those things that they need to be successful, and make sure that we continue to reduce recidivism.
Madam Chairwoman, the thing that jumped out at me was you'll take care of anybody. It's prisoner-centric.
Yep.
But when I talked to you, how about somebody come off the street? Can we get a GED? You're like, absolutely, Marty. And that's the table over there.
Yep.
Sorry, Councilman, but I preferred Marty. So I'm just impressed the heck. I'm impressed the heck when I met you. And I met you the day the Diversion Center, too.
Yep.
And on that note, how's the Diversion Center being right next to you? And it might be hard for you to answer. It's a great in concept. Is it working?
So it's getting better. So, you know, when you come to any type of program or any service, you know it's going to be hiccups in the beginning. So, of course, we, as an agency or as in collaboration with the Adams Board and the county, we had a way that we wanted to get clients into there. That way it worked somewhat, but we did have to make some adjustments. So now we do allow, prior to get into the Diversion Center, individuals had to be referred by law enforcement.
Yeah.
So now we have opened it up to now they can get referred by local shelters, frontline services, and other mental health places, and they also can do a self-referral. So if everyone in this room is not familiar with the Diversion Center, we opened about a little under a year ago. Yeah. So in the past, if you had Marcus Bell downtown and I was under the influence, you took me to a local precinct or a jail, right? And we know that jail is not always the answer for these type of situations. So you create the Diversion Center, where somebody can stay there for a maximum of up to 9 days. They can get detoxed, and you get connected to further services. So we can refer you to further treatment housing, temporary housing, and we can help you with detoxing. So now that we have that and we can do self-referrals, we have seen participation from clients increase.
Sounds good. And all I really want to do is highlight you and the wonderful work you do.
I appreciate it.
Mr. Lawrence is a legend in the community ever since I've been around, but seeing the new breath of energy that's coming, it's exciting, and I think we're all on the right path. So this is a great investment. And just, is this HHS funds?
Yes.
Because my question was, we're giving a 3-year contract, and we only have a 2-year general fund budget, but the HHS is 5. So that's how that works to get the 3-year.
Paul can speak to that.
Yes, thank you very much, Councilman. So when we do multi-year agreements, a lot of times we base the future year value on what's currently in the budget for that program, with the assumption that that's the amount that would be available in the future. if for some reason there was an issue with the budget, whether there's less or more available, we would be able to amend the contract to either raise the value or lower the value, depending on what was available in the budget.
Council approval or just by this ordinance here?
Any amendment would go before the Board of Control if it was a value under 500,000, or to council if it was a value over 500,000. So anything adjusting the value up or down, we would bring for approval.
Well, thank you for each and every one of your full answers to my questions. I am very supportive, and thank you, Madam Chairwoman, for your flexibility.
So Paul, while you're there, second reading suspension, I do believe.
If we could, please, thank you, Chairwoman. Because this is a July 1 start date, we'd like to request second reading suspension.
Okay, I have a couple questions myself. Fred mentioned that there were membership. So I just wanted to know, is the membership only exclusive to incarcerated persons or to their families and things like that?
It serves incarcerated individuals and family members who can also become members, and the general community. Anyone who has any interest, has friends, just wants information and research resources, they're there to serve anyone. Nobody gets turned away. And I'd just like to say that during the pandemic, when everything was forced to be shut down, we had a combination of many of the agencies that serve these people not being able to, and we had a huge spike in the number of releases as the institutions tried to whittle down their numbers to stop the spread within the institutions. Oriana through North Star stepped up, even though the building was closed. They had drive-through services. There was so much need because we had so many new people being released at one time and without any time for preparation. And they stepped up and maintained operations even when they had to be working outside and going to places to serve this increased number. And I think they did a fantastic job under the circumstances.
Is there a membership card? Do you give them, you issue a membership card or no? Yes or no? Yes? Okay. All right, and for Mr. Bell, you talked about the Diversion Center and how important it is in terms of pre-going away somewhere. What systems do we have in place to assist the returning citizens?
It depends on what they need when they get released. So post-release right now, we do have our halfway house that we assist some clients with. So sometimes people that get out may be on parole and just may need an address because their address wasn't approved for. We can put them into our halfway house for a couple of days until we find them more secure housing. Currently, we're working with Eden, which is why I was saying this addition to the money would assist us, where we're helping people get more permanent housing. So we pay their security deposit in the first 2 months of rent to get them into stable housing, whether it's an apartment or a house, or if they're moving in with a loved one. We know a lot of times when you have a loved one or a support person, when you're incarcerated, they become incarcerated too, meaning I'm putting money in your book. So when you come out, it's been kind of a hardship on me. So if they decide to move in and stay with their mom, and their mom might be behind on rent, as long as their mother or father or whoever is able to add them to their lease, we can pay a portion of their rent as well for a few months. Outside of that, we work closely with a couple of transitional programs, like Haven has an open door program, which is that on Woodland Avenue, where we can send men and women to get housing. That's also connected with CMHA. So that actually opens up a door that is traditionally not open for clients with a criminal background. So we send them there. And then just the basic needs that they need. State ID, birth certificate, we cover the cost for that. Like I said, education, we have a clothing closet in our warehouse where they can go get some clothes to get out of their state clothes if that's what they have. And then we just have anything else that we can do the best way to help them, I guess, if that's answering your question.
Yes, it does.
Okay.
So you get them hooked up on SNAP or anything like that?
We get them hooked up on SNAP. We work with Care Alliance. So Care Alliance come in on a bi-weekly basis to sign them up for medical appointments, whether it's dental, medical, and as well to get them. Then we work with the Cleveland Food Bank, a guy named Stephen Boyles, that assists them signing up for SNAP, getting them help with Medicaid. We help them with We work with frontline services to get them their mental health addressed and get more medicine if they need that. We actually in the process right now working with the whole COVID thing going on. We're having Carolinas come in to begin offering community vaccinations and testing for them on a weekly basis. That's supposed to start up in the middle of December. I would add that into my monthly report that we send to the Office of Re-Entry each month. I also brought, I don't know if you got, I only brought one folder, but if you wanted to share it, where I put in there, kind of the report that we sent to the Office of Re-Entry on a monthly basis so they can see how many numbers we get per month, how many we had per year. It has our recidivism report where we track individuals that come to our building, and we do a random search of, I want to say 300 people, and we track from inception from day one to a year out. We follow them to see if they got a new felony, a new crime, et cetera. And then we put our satisfactory report. So every client that come in, they becomes a member. And from time to time, we get them a satisfactory survey where they can tell us, you guys are good, you're terrible, we like the hours, we don't like it. And then based on that, that's how we move forward into the next year on how we're going to continue with programming and services.
Okay, if you could share that with that one folder to the clerk, and she'll
Okay.
make sure we get copies. Funding is tight, huh? All right, any other questions for Mr. Bell,
Madam Chair.
Fred, or Simeon? Councilwoman?
Thank you, Madam Chair. Good afternoon, gentlemen. I had a comment and a question. So I have had the good fortune of attending quite a few community meetings at Ariana House. Most recently on October 26th, there was a meeting in partnership with the NAACP, the Greater Cleveland Chapter, and the U.S. Attorney's Office from the Ohio Northern District. And the topic was understanding your civil rights, what they are and how do we protect them. And so I absolutely support your work. I look forward to, my question is, as my colleagues have in the past, if you would be open to hosting me for a tour in the near future, I would be very interested in seeing what you do at a visceral level.
We can set that up, definitely.
Thank you.
Any other questions? All right. Anything else you would like to share with us? All right, thank you. So I'll call for a motion to approve R20210280 for second reading suspension.
I so move.
Miller,
Second.
second by Meredith. All in favor, please say aye.
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 Had to give her one.
So competitive.
I am
Had to
trying
give
to
her
throw
one.
your assist and.
And I gotta say Councilwoman Turner. That's it. Okay. All right. Madam Clerk, if you could read the next item into the record, please.
Resolution 2021-0273, authorizing an amendment to contract number 366 with United Way of Greater Cleveland for fiscal agent services and emergency food purchase assistance by Hunger Center serving eligible Cuyahoga County residents for the period January 1st, 2021 to December 31st, 2021, to extend the time period to December 31st, 2022, and for additional funds in the amount not to exceed $1,220,450.
Madam Clerk, my mind is playing tricks on me. Did we vote that to the full council? The
Yes.
last item? Okay. All right, thank you.
Thank you, Chairwoman Conwell. This is an amendment to the county's contract with United Way of Greater Cleveland for the emergency food program. The county has funded this program for a number of years in collaboration with not just United Way of Greater Cleveland, but also the Hunger Network and the Greater Cleveland Food Bank. Representatives from United Way, the Hunger Network, and the Greater Cleveland Food Bank are here today. We have Ken Surratt, my former colleague at the county, here to represent United Way. We have Julie Johnson from the Hunger Network, and then Jess Morgan from the Greater Cleveland Food Bank. I want to talk a little bit about the dollar amount of this amendment, and then United Way has a slideshow that they're going to present after we discuss the item that tells a little bit about the successes that they've had over the past couple of years, particularly during the pandemic, and a little bit about an exciting new pilot that we just rolled out about a month and a half ago for the purchase of non-food items up to a maximum of 10% of the value of the contract. So those are things like feminine hygiene supplies, toilet paper, paper towels, dish soap, laundry detergent, all the stuff that is essential for folks that are living somewhere. And it's just as important as food for those people. And many times, if you can't afford food, you don't have enough money to buy those kind of essentials as well. We decided to undergo this pilot project using our existing contract where we have a built-in distribution network to get those supplies out to the folks that need it the most. So this is an amendment that includes some additional funds for 2021, as well as full funding and an extension of time for calendar year 2022. We're adding $20,000 in funding for this year, and then we're adding funding for calendar year 2022. The total amendment dollar amount is $1,220,450. $20,000 of that is additional funding for 2021, the remainder for 2022. Looking at the funding for 2022, we're going to have $25,450 in administrative costs for United Way of Greater Cleveland to administer this contract, and then $1,175,000 for food purchases in 2022. And that compares to a dollar amount of 2019, $1,090,000. So right now, as of January 1st of next year, we're going to be spending $85,000 more per year on food than we were up to 2019. And that dollar amount, I think, was fairly standard between 2010 and 2019 of that $1,090,000. That additional expenditure affirms the county's commitment to this program as an essential way to get food out into the community. There were some questions that came up from council about the dollar amount on administration versus food in calendar years 2020 and 2021, because there had been $50,000 added by amendment per year starting in 2020. The first year, those were used exclusively towards food purchases. This year, my team authorized those $50,000 to be used for administrative purposes. It's my understanding that we want those dollars to be rededicated towards the purchase of food and to address the $50,000 in 2021 that was spent for administrative purposes rather than for food purchases. What this amendment allows us to do is to invest $15,000 more in food for this year, and then an additional $35,000 in food for next year, to make sure that that $50,000 is kind of made whole as part of this amendment. Going forward, that extra $35,000 is a commitment that we intend to keep in the budget for this contract as well. I'm happy to answer any questions about the amendment. As I stated, this is an amendment to an existing contract, and the contract included option years for extension. We're exercising one of those option years with this amendment.
Okay, so let me start, Paul. Let me get clear. You said to make up for the 50 that was not provided because it was used for administrative fees, in 2021, this contract here is going to add 15,000.
Correct.
And then in 2022, it's going to add the 35.
35,000 plus the 50,000 that was there for amendment. So that will cover the entire 50,000 for this year, as well as the 50,000 for next year.
So that's where you come up with your 85,000 more on food?
Correct. If you look at what our spending is going to be next year on food and compare it to what it was prior to 2020, it's an additional 85,000. If you compare it to 2020, it represents an additional 35,000.
And the $15,000 more would be received when?
If we can get this approved on second reading suspension, I know I'm getting a little bit ahead of myself, but we would be prepared to process an invoice for that $15,000 prior to the fiscal office's year-end cutoff at the end of next week. I know that our finance team is really feeling the pressure to get invoices processed before that cutoff deadline. but this is one item that the HHS Finance Director is aware of, that we would look to process invoices as soon as it's approved by council. So we could theoretically get that 15,000 done next week. And then we would do the 35,000, whenever the budget becomes available for next year.
So that 30, because that was my next question. So the 35 for 2022, and then the 50, that's 85. Is that going to be all given at once, or is it going to be spaced out?
Sure. So this contract, we get monthly invoices from United Way as part of their administration of the contract. Those invoices typically include actual expenses for that month. If there are expenses that were incurred but not invoiced in 2021, because this is an amendment continuing the existing contract, the vendor would be able to go back and invoice us for 2021 costs, probably in their first invoice in 2022. Additionally, we expect that the December 2021 invoice wouldn't come in until the first month of 2022, so it could be included on that December invoice to be paid out in January.
Okay, and so the 15, if they don't use the 15,000 in 2021, they can carry over?
Correct. The budget is not carrying over, so our goal would be to have that included in an invoice for, the month of November, for instance.
And then I just want to, before I turn it over to my colleagues, I want to go back to your presentation where you stated that this contract that's before us, this amended contract, includes non-food items.
Correct. So there was a $0 amendment, Councilwoman, that was completed about a month and a half ago. It was during the month of October. That $0 amendment did not change the value of the contract, but it allowed for the purchase of non-food items, those kind of essentials that I mentioned, up to 10% of the total contract value.
But you also stated that, Paul, that it was a pilot, and I'm looking at this was an original First Amendment of the contract in 2010, as well as, and it carried over to the Second Amendment as well. So is it a pilot, or is this something that we've always had?
So this is something that we just rolled out in October, and I'm trying to use the pilot language just to describe it as something new that we don't have a ton of data on, although the slides will indicate what some of those expenditures have been just in the short period since we added that option. It is our goal, if this is successful, to continue to allow this as an option under the contract. You'll see in the slideshow that there is definitely demand for this, and we're not looking at removing it from the contract, certainly not with this amendment. And as long as it's something that's successful, I can't imagine removing it moving forward.
So my whole point is that it's not really nothing new. It's not a pilot. They've always had the option to get that at least 10%. So is that out of the 10% that they're allowed to utilize for non-food items, that's encompassed in the dollar amount that we have before us, correct?
Correct. That's within that. And I do want to clarify that that 10% is only an option that started in October. If you were looking at something earlier than that, I wouldn't be aware of going back, multiple years, whether that was discussed before. But this was a fairly new topic, and we put the amendment through this year to address the need for those resources and to get those out in the community.
So it predates you then, basically.
If there was something prior, yes, that would predate me. I don't know if anybody from the food bank wants to talk a little bit about that, Jess, or Julie from the Hunger Network, or Ken from United Way. But contractually, that would, again, the contract that was put in place at the beginning of 2021 did not include that option. We added it by amendment. So none of the invoices the county has been paying have had non-food expenses up to October. It's possible, that those supplies were available just through other funding sources previous to this.
We'll reserve questions only for Paul at this time. Councilman Miller?
So, Madam Chair, the additional 20,000 that's in this amendment for 2020, is that going to be spent on food or administration or a combination?
Thank you, Councilman Miller. A combination at this point, so we're going to earmark 15,000 for food purchases and then 5,000 for administrative expenses. We have asked United Way to do some additional work related to the non-food pilot, so we're looking at giving a small increase for the administrative fees related to that additional work.
And how much was the total amount authorized and spent on administration in 2019?
In 2019, it was 5,450, and the same as the original value of the food purchases. That amount had been the same, I think, going back to 2010. So neither the food purchase amount nor the administrative costs had any increases in those 9 preceding years.
And how much is going to be the total amount spent? And how much was spent on administration in 2020?
Sure. In 2020, it was invoiced as 5,450, same as in 2019.
And when you add the 5,000 to what was already authorized, how much is going to be spent on administration in 2021?
Sure. So the total amount, given what was initially in the contract, the extra 50,000 and then 5,000, that would add up to 60,450.
So, and for 2022, it's 25,000. Is that correct?
Correct.
So, so what additional work was done in 2021 to account for $60,000 being spent as opposed to 5,000 in the prior years and 25,000 in 2022?
Councilman, the conversations at that time were that the 5,450 had not been sufficient for administrative purposes for a number of years, given the amount of administrative work we were expecting from United Way. So if you look at it that way, it was underpaid for several years. What we're hearing is the desire to spend maybe more, but not as much as 50,000. That's why we're trying to get to that 25,450 figure. That said, we require United Way to do monitoring visits at each of the specific sites that these services are offered under, as well as invoicing for the contract, and then a certain amount of reporting on the contract. As the number of centers has gone up and down, they've had to monitor either more centers or fewer centers or different centers depending on the contract year. So there is a significant amount of administrative work that goes into this that, you know, perhaps from the start of the contract was maybe lower than what the actual amount of work that United Way does ended up being. So
Madam Chair, so what you're saying is that the 2021 figure was kind of a catch-up that included 2021 plus some funding for what wasn't provided in prior years, and that you're hoping that the 25,450 is going to be the normalized amount going forward.
That is our goal, yes. And the amendment reflects, you know, putting a priority on the food itself, as well as acknowledging the level of work that goes into the management of the contract.
Okay. Thank you, Madam Chair.
Thank you. Okay, so, you know, I have lots of questions, but we'll continue on with the presentations at this time.
Perfect. I'll call Ken Surratt up then. He's going to present a slideshow about the services provided under this contract. Thank you.
Good afternoon, Chair, council members. It's been a little while before I've been back at the podium. Thank you, Ashley. Paul actually took a lot of my thunder in this. I just joined United Way about 6 weeks ago. Familiar with this contract from when I was here at the county. But I'm going to try and be brief in my remarks because I think the important information is really how we're addressing the food insecurity in this community. And we have Jess Morgan from the Food Bank and Julie Johnson from the Hunger Network who can share some information about that, as well as Paul mentioned the information on how the non-food item work has progressed. Again, I'm not going to go into a lot of detail on this slide. A lot of it was talked about. Really just sharing about our role. Councilman Miller, your question asking about the administration, I think Paul actually hit all the things that we want to talk about. The one thing that I'd say in addition that we do on an important service kind of more broadly is really through our 211 services too, where we actually get a lot of calls in and help refer out to these resources too. So there, we feel that the $25,450 going forward is the right amount to cover what is our actual effort in this contract. So again, the monitoring, the reporting, the invoicing, but and kind of separately, there's also a resource in 211 that helps address the food insecurity challenges here in the community. And so I just want to share a little bit about this, and starting really from the bottom is January, and this is 2020 data. You can see exactly when the pandemic hit, and the bars jump up, and this is our as a percentage of all the calls that come into 211, really about needs for food. So there was a 226% increase from our normal call volume around food. It definitely was a strain on our call center, but something we are happy that we were able to help refer people to the resources that the Food Bank and the Hunger Network have. So with that, I will actually ask Jess to come up, who will talk a little bit more about the impact of these dollars that you have provided on the food bank side.
Good afternoon, council members. Thank you. These masks are not designed for jewelry.
They're not.
Madam Chair, thank you so much for welcoming us today. My name is Jessica Morgan. I'm the Chief Programs Officer at the Greater Cleveland Food Bank. This slide speaks mainly about the food bank's reach in total. So the food bank serves 6 counties in Northeast Ohio, with Cuyahoga being our largest. We offer 14 different hunger relief programs, and through those programs, last fiscal year, we served over 343,000 people. That is an unduplicated count. 36,000 of those people were children through our targeted children's programming, and we were able to serve or help submit over 11,000 SNAP applications and provide over 52 million meals. We distributed about 53 million pounds of food last year, 53 million pounds of food. We get our meal count by combining food and SNAP applications. There's a formula that we use. We distributed about 22% of purchased food. That means that we purchased about 22% of the inbound product that came into our warehouse. 32% of what we distributed was donated, and then 46% was federal or state commodities. In a typical non-pandemic year, the food bank will distribute about 10% of purchased product. So our purchased product is definitely up, and that's in large part due to decreases in donations, as well as federal and state commodities. Oh, I have the clicker. There we go. The data on the next slide is from 2020, but in partnership with the Hunger Network, we have about 33 now shared partners. The food bank also has hundreds of additional partners in Cuyahoga County. And through all of our programming, we served 1 in 4 people in Cuyahoga County in 2020. 70% of the population of income-eligible residents were served by one of our 14 different hunger relief programs. And then Mr. Porter mentioned our we're calling it the non-food pilot as part of the contract. So this started the second week of October, and this data is through last Wednesday, so just before Thanksgiving. It is going very well. And so the non-food product is something that the food bank has always offered as part of our distribution model. The county grant in my 10 years at the food bank has only covered food, delivery, and paper bags. So this started in October after some questions were asked by our partners. And Julie and I from the Hunger Network came to the county and United Way over the summer and did ask if we could try this and see how it would work. I'll let Julie speak to some of the anecdotal information about the partners and how they have appreciated having county dollars to purchase these items, but you can see what that impact has been. About 4% of the total distributed has been non-food during that second week in October through last week time period, and the impact of that could be seen below. We wanted to break out, what did this look like? We talk in pounds and cases at the food bank. It's not all that impactful, so Julie had the great idea to break it down into, terminology that we reference on a daily basis. So I won't go through each of these numbers, but it's certainly something that not only benefits our network of partners, but clients, because these items are not covered by SNAP benefits. And so likely when they're going to a food pantry to access emergency food, it's critically important that they also have access to these hygiene products and household items. I am happy to answer any questions before I turn it over to Ms. Johnson.
Yes, I have a couple. Ms. Morgan, are these non-food items much cheaper? Most people, be it agencies, are able to buy from the food bank because they get it at a cheaper cost. Are these hygiene products the same way?
They can be the same way. It just depends on the item and how we have sourced it. Things like cleaning products and hygiene products in general, right now the supply chain is just, prices are through the roof across the board. And we are certainly seeing increases both from a food perspective and non-food perspective.
And then my other question would be, looking at the flow chart, going to the flow chart, I see that, which I wasn't aware of, but you provide upfront cost for all of this to take place. How does this impact the agency?
So we are sourcing our food typically 3 to 4 months in advance of when it hits our warehouse. A challenge we have seen recently is specific to freight and delays in shipping. And so we do need to make sure that we are bringing product in, we're purchasing food. I mentioned that we've had an increase in the number of product we've purchased. And so we really do have to do our due diligence and kind of predict out how much product we think will be distributed in the months to come. We budget every year. We try to put together a distribution plan that helps to guide some of this work. So we are fronting the cost of that product as it comes into the building, and then we are reimbursed after the food has been distributed.
It takes quite a long time.
It does. It could take anywhere from 3 to 5 months.
I didn't like that. And also, for the record, do you or do you not receive administrative fees for this?
We do not receive any administrative fees.
All right, Councilman Miller.
So thank you for all the good work you do in addressing a very important need in Cuyahoga County. And my first question is whether the sharp increase in demand that we saw in March and April of 2020 when the pandemic started, whether that that increase has been maintained or whether it's settled down a little bit. Has it gone back down to what it was previously, or is it somewhere in between, or where are we at right now in
That is
terms
an
of the?
excellent question. Thank you, Councilman Miller. So we are somewhere in between. In 2020, when the pandemic hit, we served over 400,000 individuals last year. This year, we're at about, this past fiscal year, we're at 343,000. Pre-pandemic, we were around 300,000. So we are still seeing more individuals in need than pre-pandemic levels. I think another interesting statistic is that since the pandemic has started, we have doubled the amount of new clients we have served. So these are individuals who have never had to turn to a hunger relief program before. Folks who have been impacted by layoffs or lack of employment, reduced hours, who may have had a small safety net, no longer have that.
The other question I had was regarding SNAP. As if I recall correctly, when the pandemic hit, that certain procedural accommodations were made, that the redetermination process was much easier. And my question is whether those enhanced benefits remain in place, or those special considerations expired, and if so, what impact is that having on access to SNAP?
Sure, that's a great question. I am not a SNAP expert, so I will do my best to answer the question based on what I know. There are still some pandemic-related benefits, giving households the maximum amount of SNAP allocation that they are permitted. All of the benefits combined between stimulus and SNAP in the past 20 months have lifted nationally about 17 million children out of poverty. So that is just a huge number, and I think you can whittle that down to local efforts as well. But there are still some SNAP pandemic-related benefits in effect.
And is the redetermination still easier than the usual process, or has that reverted back?
Sneaking up here.
Thank you so much.
Morning, Council. Pardon me, afternoon. Kevin Gowan, Job and Family Services. To answer the question directly, the redetermination process is back to normal. It is back in place. It was only waived for April, May, and June at the beginning of the pandemic. And some of that, it was only waived for 6 months. So we actually saw a wave of increased redeterminations starting in, I got to do the math, October. They did a few more adjustments there, but now we have kind of a sporadic wave where redeterminations are actually heavier in some months, specifically actually in the fall, than they are normally. But the redeterminations are back in full force. The one thing that has been suspended throughout the pandemic, with the exception of about 3 months, are interim reports, which is a paper report that everyone has to file 6 months after applications or their last redetermination. Those have been suspended during the pandemic, and that suspension, or that waiver, I should say, is set to expire at the end of this year.
So currently, how often does redetermination on SNAP have to be done?
When you apply for SNAP, you are certified for 12 months, and you are recertified for another 12 months once you do your redetermination.
And is there any limit on how long you can be on SNAP?
There is no actual limit on SNAP as long as you continue to meet the income guidelines and you complete your redetermination and interim reports during the duration.
And have we seen any decline in the number of SNAP active families in Cuyahoga County because of the redetermination process being back in full force?
We always see people who do not complete the redetermination process. I don't have hard numbers on that, largely because I do not have a report that tells me that. What I can tell you is during the pandemic, SNAP rolls increased to roughly, at the very beginning, roughly 235,000, as opposed to just over 235,000. Previously it was right around 200,000. Right now, we did see a drop after that March-April surge. largely from people who were applying for unemployment, didn't get it in the initial stages of the pandemic, but eventually did get it. They went off the rolls of SNAP in June. So we saw the rolls drop. Right now, they're at 220,000 individuals on SNAP in Cuyahoga County.
Okay. Thank you very much. Thanks for the answers.
Excuse me, Madam Chair. I'd like the record to reflect that Councilwoman Stevens is now in attendance.
Okay, thank you. I have a question for you, Director. In terms of, I think during COVID or the pandemic, there was some adjustments made where individuals that were on SNAP were allowed to buy non-food items. Is that back and forth?
The adjustment on what specifically? I apologize.
From what I've heard is that during the pandemic, individuals that were on SNAP were allowed to utilize their card for paper products and things that they needed. Is that from the state of Ohio? Has that?
That is not accurate to my knowledge,
Not
no.
accurate?
No.
Okay.
It's still for food only.
Food only?
Mm-hmm.
Okay. Shows miscommunication out in the community. Okay, all right. Councilman Sweeney.
I just had one question when you talked about the folks that had the small safety net, and then they came to you. Have they left the sense? And the other one is the folks that really don't know about you, right? What population is still there that could be coming to you to, if they haven't left and new ones are coming, it's just going to keep growing and doesn't matter about the pandemic, because the pandemic was the thing that caused them to realize that you're here and what a wonderful resource that you are. And that just concerns that it could triple. Can you talk about that briefly without being?
I sure can. So we've had a decline in the number of new people served in our fiscal year 21 versus fiscal year 20, but it is still higher than 2019. So it's following kind of that same trend. Can you repeat your second question?
Just the folks that have no idea about you.
Right.
Right, and then all of a sudden, oh, it's available. I never knew, and that's just more new people coming, either by advertising or by word of mouth.
Correct.
It's a wonderful resource. You're pulling along pretty good. This pandemic occurs, and what long-term impact it's going to have on you post-pandemic, and I think it's going to be an increase just from my deductive logic.
Yes, and so that's an excellent question. So there is a gap between those that are eligible for SNAP resources and then those that are eligible for emergency food, where between 130% and 200% of poverty, those individuals are not eligible for SNAP, but are eligible for emergency food. We recently did a study about, how our services are out there. How do we get people to call, to ask for help, to feel comfortable asking for help? We hosted a conference for our network of partners to talk a little bit more about that, making that resource at whatever organization you're at more front-facing. Instead of having a food pantry in the church basement where nobody can see it, making it more front and center and welcoming, so that individuals do know where to go and get help. And we partner very closely with United Way with their 211 line. And we do have a help center at the food bank where people can call and apply for SNAP. Apply for SNAP over the phone. We'll take their information to submit an application and also get access to other food resources. So there is a stigma attached, for sure. It is something we work towards every day.
Well, thank you very much. I appreciate your answer.
Thank you.
All right, thank you. We may reserve to call you back.
No problem.
Director Johnson?
Good afternoon, Madam Chair and members of council. It's a delight to be here. This is actually my first time speaking in person in front of you, given the challenges we've had with the pandemic. We've kind of bounced back to the food aspect on this next slide that's going to come up here. And what I have reflected here in this graph is just the differences that we've seen in the meal supply. So we measure in meals, not pounds of food, same as I had asked Ms. Morgan to provide in bottles and units rather than poundage, because it's a little more impactful and understandable to the general public. the differences over the last 3 years, and these are actually only the differences in the 32 county-funded sites versus the 74 food pantries and hot meal sites that are members of Hunger Network across the Cuyahoga County area. And so you can see from the lines how much that's actually increased. And September 2021 is the most recent number that I have for meal provision, which is up to 404,118 meals that were served. And that's a formula we figure utilizing the pounds of food that the food bank measures and the number of meals that we serve. And so that's up quite a bit, as you can tell, between 2019 and 2020, based upon the graph there. And so some of this increase is definitely due to the pandemic. And as Ms. Morgan spoke of in her report, new families and the unemployment that's happening in the community. Some of this influx that you're seeing on these different figures also is due to the increase in the amount of food per days we've given for families. So traditionally, I would say in the 2019 and 2020 year, we were providing enough food to last each member of the family 3 days, to provide 3 meals for each family member per day. And then as the pandemic increased and the need started becoming greater, we slowly found that the centers were serving folks not frequently enough, and they needed the additional access to food based upon unemployment, and particularly the children being home from school and not having those school-funded accessible meals. So then we increased to 5 days worth of food, and then eventually 7 days, and in some circumstances, even up to 10 days worth of food per person based upon their accessibility of the pantries and the needs that they were reporting in the various areas across the county. So that, helps adjust some of that.
Was it, Director, still 3 meals a day for those 5 days and those 7 days?
Was the directive?
No,
I'm
was
sorry.
it still 3 meals per day? When
Yes, it would be 3 meals per day per person per household. How we like to package food that's presented from our pantries, we recommend that they provide what's in the bag to create a meal. So it's not just putting a few cans or a few boxes or meat. We try to ask the pantry managers to really sincerely think about what goes into a meal per person and include those items in the bag. Most of the time, those items are available. Sometimes they're not, and we're finding it to be a little bit more challenging with the supply lines and increasing again due to the pandemic, that what might be needed to try to meet those dietary meal requirements aren't available. We do anticipate challenges to ask. I believe it might have been Councilwoman Sweeney that asked, seeing the differences of what might happen. And this is purely based upon observation. It's not factual. But I'm going to guess that because of the increases of the cost of food and goods, that the need is going to continue to rise in the community. And so maybe we may or may not see the traditional families or as many new families that were impacted in the pandemic, but particularly maybe even an enhanced need based upon that, particularly for produce when fresh produce is available. And then we did mention that sometimes in the contract over the years, we have either added or subtracted county-funded sites. So we are hoping, we've actually just moved the location of Hunger Network recently over the past year from the Rockefeller Building downtown, which was highly inaccessible, to Midtown. So we are now on the Euclid corridor, right between 40th and 46th Street. And we're in the process of opening up a small pantry there to try to serve that Midtown region, and particularly those folks that are on the Health Line, which extends all the way out from East Cleveland all the way to downtown And we're working on currently obtaining the other half of the building. We currently have half of the first floor on the front of the building. We'd like to obtain the second half of that to expand the pantry and particularly add more space to offer those fresh fruits and vegetables that are so desperately needed. Right now, we haven't secured the funding to do that, but we are in the process of working towards that. And so if I might just speak a little bit about the hygiene items, the amendment that was added to the county. Ms. Morgan had given you the bottles and the unit counts based upon it, but how we originally came to the conclusion that we needed to ask for the hygiene items was again due to the pandemic, when we had received special funding through the Cleveland Foundation for rapid response to provide particularly hand sanitizers and home cleaning products, masks, gloves, paper towels, all of those items that were not regularly available through the SNAP benefits or had been allowed to be included in the contract where we purchase food from the food bank, or they sometimes have the items for free that are offered to our pantries as well. So when folks had to start making those difficult decisions between having one item or the other when they came to the pantry once per month, we received that feedback. So now what our centers are reporting with this allowance for the 10% of hygiene items, they're offered boxes of items rather than one product or the other where you have to pick between paper towels or dish soap. And they're actually given a nice box, one of our centers reported. And they're giving them to them about once a month, and they continue to give the paper products like toilet tissue and paper towels more frequently than they were originally able to do so. Feminine hygiene items are always something that is difficult to come by. So those items have been included into the boxes. And as I mentioned, the toilet paper and paper towels have been provided weekly. So the picture of the items to your corner down there is what the Brookside Center from St. Vincent de Paul offered in their last distribution, which just occurred on November the 21st. And at this time, I would be welcome to answer any questions that any member of council may have.
I wanted to ask, last time we spoke, are you still in the process of getting transportation, or did you get?
Well, we have not yet leased or purchased a truck, but we did run a campaign where we've secured, we believe, sufficient amounts of funding to purchase a truck into 2022 that would help us. It would actually help us fulfill another county contract that we have as well with the fresh food distribution, in addition to our food rescue program and getting the supplies out into the community. We could actually have pop-up locations if necessary.
All right. And hearing the previous discussions that we had this morning with Paul, Mr. Porter, you're okay with the 50,000 that you didn't get, and it was broken down to 2021 to 15,000, and then in 2022 seeing that remaining balance?
Correct. I think that obviously United Way puts a great deal of work into the contract and needs to be compensated for their time. It was just a surprise to see the contract amended so much between 1 year into the next year, which caused the question.
Okay. So your agency is back on solid ground and good footing. Any questions for? Thank you.
Thank you very much for your time.
Mr. Surratt, I had a question for you. Dale asked my earlier one, how much is for the administrative costs going forward, but are the administrative fees that you get only covering this Hunger Network contract?
That's concern out the United Way. To the chair, yes, the administrative fees that are for this contract solely cover staff working on this contract.
Okay, because you have other sites that you feed as well, correct?
We have many programs that we work at. We want to make sure that we account for every dollar that comes in the way that it's supposed to be done for each one of those contracts.
Okay. Is there a sole person that works on this, or?
I would say from my community investment staff, Shelby McGee, who's here, is the main person, but what is not, in terms of like the typical management coordination side of it, but then there's people from our fiscal staff. We have legal that has to review this. We have, and Shelby does the monitoring and reporting as well.
Now, I know you were here prior to when this collaboration kind of started, so now you're back. In your opinion, is this something necessary that your organization needs to do? I mean, I don't think $25,000 is going to break you, but and the reason I'm bringing this up is because of the flow chart. You know, the food bank actually putting upfront cost, and it's taking so long for them to get reimbursed. So I'm reading the flow chart, and I don't know if you were privy to the flow chart of how the funding flows. But from my conversation with CEO and President Christian yesterday, so I just want to get clear how this money is funding. They give the upfront cost, and then they notify United Way that they purchased the items, and then United Way lets the county know, and then monies are allocated finally to the food bank. So have questions about when we pass this contract here, if we should pass this contract, does the county give United Way the 1.2? Is it given to you in your coffers at that time, or is it still here and then you have to send us invoices and stuff like that? So I need to be clear on that, number one.
Sure. To the chair, it is an invoice process. So we submit the invoices, and then we receive funding that we pass through. And this is I will know this is the first time I've seen this document. So, but I'll say this. We actually, in many ways in the community, have served as an intermediary historically in a lot of different partnerships and collaborations. I think because we have a lot of capacity. So we do have fiscal staff. So we have supported startup nonprofits in this community to help make sure they get on their feet, house even physical space for some new initiatives as well. So we see our role as really being that of service to the community. And so if we're asked to help administer a contract because we have the resources that maybe another organization have, we're happy to do it, and really just try to do it at that cost. As Paul mentioned before, $5,400 for all the work that we do over the last, it honestly, it just didn't cover our expenses. We're not looking to make money off of this by any means. We give money away, right? That's what we do. But we do want to make sure that we are able to provide those services to the community. That said, if we're happy to open discussions on future contracts about what's a better, more efficient way to make sure this happens.
And it's efficient for you, and we thank United Way for stepping up. And by any means, I'm not trying to change. I just want to make light of this flow chart, which was presented to Augie. By the way, you may not have saw it. that it's working well so far, but if there should be some financial challenges for the food bank, it wouldn't work so well because it's taking 3 to 4 months for them to be reimbursed, and I don't know. So I challenge you guys to really reopen those conversations to see how that goes. That's kind of unfair for any nonprofit, no matter what their size is. And just to be clear, just to make sure that you're clear, we are thankful that you're in. In any way, have I had, or this committee had any problems with United Way administering the contract? The issue was that Hunger Network was not going to get, there was a potential that they weren't going to be reimbursed for the $50,000 they got. So my thing is all about the people getting what they deserve. So if you misunderstood that in any way, I want to make that clear, that it was all about making sure that that $50,000, especially since we're in budget cycles right now, if we could assist that or whatever so they could be made whole, so the individuals out in the community could be made whole.
And we appreciate that and agree. We're a service organization as well, and ultimately we want to make sure the people who are in need, those needs are addressed.
Right. Any final questions?
Madam
Councilman
Chair.
Miller?
I have a question for the food bank. I know that Madam Chair, to the representative, when I've visited with the food bank in the past, you described an effort to get clearance from the state so that when a person had issues around eligibility, that you would have the authorization to work with them directly through their call center rather than having them have to go through the state system, which is cumbersome. And my question is whether you've been able to work out that process.
Thank you, Councilman Miller. Are you referencing SNAP? It's a
Yes,
to SNAP
SNAP.
applications? Thank you. So the food bank does have a help center where we can take phone calls from clients who would like to apply for SNAP over the phone and submit their application on their behalf to their local county office. We have been working very closely with the county, for, look at Mr. Gowan, probably 2 years, on making sure that the statewide system is the most effective that it can be. We are in constant communication with the county and meet with them monthly to talk about challenges and successes. I know at the state level, we have also been involved in conversations from an IT infrastructure standpoint, trying to speak on behalf of clients who have had some trouble submitting applications or who have experienced, challenges with wait times and that sort of thing. So that is an ongoing conversation, and we're just committed to being a collaborative partner in that effort.
So it sounds so that they have not yet authorized you to directly resolve eligibility issues. Is that correct?
That is correct. All of those resolutions must go through the county office.
And have we had any improvement in SNAP eligibility processing? The last I heard, it was something like a third of the applications don't get approved and a third don't get approved in a timely manner, and a third of them do go through, but it's not a real good percentage. Is that still the same, or has that gotten better?
So I'm not sure I'm the best person to speak on that. I'm not sure if.
Thank you, Councilman. Again, Kevin Gowan, JFS. Our timeliness rates have actually improved during the pandemic. So the federal requirement for us on timeliness is 95% of our caseload. 95% of our incoming applications are approved within 30 days. That percentage we were below 95% when I first started this job back in 2018. And during the pandemic, for a variety of reasons, we improved to actually, at 1 month, 99% of those cases. Some of that had to do with the waivers that we talked about earlier today. But we have been between 92 and 96% over the past 6-7 months. So the timeliness has improved during the pandemic.
And have we seen improvement in the problem that we had where a lot of the applications were rejected for this piece or that piece of information not being provided or not being right, and there seemed to be a lot of communication problems around helping people get the right information into the system. Has that improved, or is that still where it's been?
Unfortunately, that's not something that we can actually track. It's not something, so the timeliness is a federal measure. Our system tracks that timeliness. I couldn't tell you. What I can tell you is that when we reject something because of lack of verification or documentation, it's because the federal regulations require us to do that. And that we have been, just like we meet with the food bank and legal aid and on a monthly basis to talk about some of those issues. We've also conduct quarterly forums to inform our local community partners on what they really need to help people move through the SNAP application process. I'd like to say that it has improved, but it's not something, unfortunately, that we can track.
Okay, thank you.
Any other questions? Okay. Thank you.
Madam Chair,
Yes, Mr. Miller.
I'll make a resolution to make a motion to move Resolution 2021-0273 to the full council with recommendations for passage on second reading suspension.
Second. Okay, it's been moved and seconded. I'd like to, all in favor to move this to the full council under second reading suspension, please say aye.
Aye.
Okay, any nays? Any abstentions? All right. Thank you. This item has been moved to the full council. Thank you. Any miscellaneous business? This meeting is